Welcome to Reach Out, the program that highlights the amazing work carried out by local nonprofits, the wonderful people who lead these organizations, and the committed volunteers who give of themselves but wind up receiving even more. I'm Bernadette Wagner, Co-Director of Volunteer Washington County, and today I'm pleased to introduce Robin Robertson and Bruce Brooks of the Community Free Clinic. The Community Free Clinic has an incredibly caring and compassionate staff that meets the medical needs of the underinsured and uninsured in Washington County. We are so fortunate to have Robin and Bruce here to tell us about the services provided by the Community Free Clinic and how it strives to care for the whole patient. Welcome, Robin. Welcome, Bruce.
Thank you, Bernadette.
Thank you for joining me today. Robin, can you start us off telling us a little bit about the history of the Community Free Clinic?
I can. The clinic was formed in 1990 at the Union Rescue Mission because there were no services in Washington County for folks who were uninsured. The first year we saw 400 patients, and in 2012 alone we delivered over 15,000 patient visits.
Wow.
We treat any member of Washington County who is a Washington County resident and who's medically uninsured, and we provide a full range of primary care. We provide their prescription medication, we do their blood work, and we do have access to many specialists in the community who will see our patients also.
And the physicians who work at the clinic, are they volunteer physicians?
We have one certified registered nurse practitioner on staff. The other 33 providers that come to the clinic are all volunteers.
That's impressive.
Yeah.
That's really impressive. And Bruce, what do you do at the clinic? What does your job entail?
I'm a licensed practical nurse at the clinic, and I work in the clinical area, assisting the providers, screening patients, explaining medicines, following the orders that the providers give.
And providing comfort to those who come through the doors.
Yes.
That's right.
Yes.
Now you've been there 15 years, and how long have you been at the Community Free Clinic?
I think about 8.
Okay.
Yeah.
Well, I'm sure that's a continuity that really benefits the patients that come there. I know that the clinic strives to provide care to people regardless of their race, their income, I guess their income level if they don't have insurance, their gender, their sexual orientation, their religious background. Can you talk to us a little bit about that, Robin?
Absolutely. We are here to serve any resident of Washington County. We do not discriminate based on socioeconomic status, race, religion, sexual orientation, any of the above. We're here to serve any and all who come through our doors. We see patients from all walks of life. It could be someone who is not eligible for medical assistance or some of the other state-funded programs. They work, so they make just a little too much money that makes them not eligible, but not enough to purchase health insurance through their employer, or their employer doesn't provide health insurance.
Right.
It might be someone who's between jobs. It might be a patient who has recently lost a job. It could be a student who is no longer eligible for their parents' insurance. And over the last 2 years specifically, we've seen a very big change in the dynamic of our population, in that we are actually caring for colleagues in our community, people that we've worked alongside who have lost jobs and lost health insurance. So it could be any of us at any time.
Right. Because the clinic serves such a diverse group of people, I know that you wind up working with many different agencies in our community, the Mental Health Authority, Teens Have Choices, tons of different. Can you tell us a little bit about some of the partnerships that you've been involved in?
Sure. The Community Free Clinic would not see the success that we do without collaborating with other agencies in our community. Many times patients come through our doors and are looking for a resource that we can't provide, but we certainly can send them where they need to go. So oftentimes, we will call other organizations, and there's too many to name individually, but we work with Commission on Aging, we work with Teens Have Choices, we work with United Way, we work with Commission on Aging, we work with Food Resources. I mean, the list goes on and on.
You're really there for the whole person.
Absolutely.
Yeah.
It's a holistic approach where we try to provide all areas of their health care.
And I know that you've worked with the Teen Pregnancy Prevention Program, and Bruce, I believe you've been involved in an outgrowth of that, which is called Reaching Outside the Box.
Yes,
Can you
Reaching
tell us a little
Outside
bit
the
about
Box.
that?
Yes, that started about a year ago, and it's a coalition of agencies and individuals in the community that are reaching out to the lesbian, gay, bisexual, transgender community and ensuring that they are getting the services that they need and that providers are aware that they are there, and maybe there needs to be some sensitivity to that group and that they're not overlooked.
And I think that came out of the Teens Have Choices study that said those kids that fall in that group are at higher risk for dropping out of school, homelessness, and a couple other risk factors.
Yes.
So this was a group coming together to support the teens in our community.
Yes.
It is.
And Robin, did you isn't the clinic involved in a teen pregnancy prevention program as well?
We are. We're actually in our 6th year of providing pregnancy prevention to teens in Washington County between the ages of 13 and 19. Teens can come into our clinic. We operate on Mondays and Thursdays beginning at 4 o'clock. It's very anonymous, it's very confidential, and they can ask questions, receive educational material, have pregnancy testing, STD testing, they can receive oral contraceptives, anything related to their sexual health. The door is open at 4 o'clock on Mondays and Thursdays for anybody who comes in.
And I think part of the outgrowth of that was an event coming up on May 18th, is that right?
Yes,
The
Hagerstown Hopes.
Hagerstown Hopes.
Yes, there was one last year, and this is the second one this year. It is May 18th. It's going to be at Dobbs Woods from 12 to 4. There will be vendors and entertainment and information and music. And again, it's geared towards the LGBTQ community and a celebration of that.
Well, that's great. Well, I'd like to thank you both for joining me and for taking time to join us on Reach Out. And also thank you, our viewing audience, for tuning in to today's program. I'm guessing, like me, you learned something new about an extremely important community resource. If you need medical care or want to get involved with the programs mentioned today, please check out VWC's website or call the Community Free Clinic. We really encourage each of you to consider how it is that you can serve your community. Like our Afghan here, each one of these is separate, but when joined together provides tremendous support. And that's how we as a community function too. Joining together, we are stronger.